Hello, I am Dr. Samantha Benjamin Allen, board certified in physical medicine and rehabilitation, here to talk to you today about stroke. A stroke is a cerebral vascular event that results in disruption of blood flow to the brain with rapidly developing clinical signs of brain dysfunction that can lead to death. Common effects of stroke include hemiplegia, or weakness on one side of the body, speech deficits, or aphasia, which can include word finding difficulty or not being able to form words at all, visual deficits, sensory deficits, such as numbness on one side of the body. It can also include cognitive deficits, such as disorganized thinking or behavior, decreased awareness of self, and knowing where your body begins and where it ends. It can include neglect, where a person is unable to acknowledge one side of their body, which may result in dangerous outcomes if they are not supervised. Common effects of stroke also include shoulder pain, bowel and bladder dysfunction, spasticity, which is increased tone in the muscles, can cause DVT, also known as deep venous thrombosis or blood clots, can result in depression, which is very common after a stroke, and sexual dysfunction. Recovery time after a stroke varies from person to person, but the most dramatic improvements after a stroke occur in the first 3 months after onset. However, improvements can continue to occur much more gradually thereafter, up to 1 year and even more after a stroke. So one must not lose hope that if in 3 months after their stroke they have not reached a point of their satisfaction, that is where their recovery ends. After a stroke, it is very important to undergo therapy that is targeted to the areas of dysfunction and deficit that a person with a stroke is suffering from. For instance, a speech therapist would address issues with speech and swallow dysfunction. An occupational therapist would address functional deficits in activities of everyday living like bathing, dressing, toileting, etc. And a physical therapist would address mobility issues and strength issues and balance issues that affect gait. After a stroke, it is commonly asked, especially by males, when will I be able to engage in sexual intercourse again? Or will I ever be able to? As mentioned, a stroke can affect sexual function, but the more important question to ask is, how can I preserve my sexual function? It is important to remain compliant with your medication, diet, exercise, and therapy regimen. Sexual dysfunction after a stroke often is related to fear, anxiety, guilt, shame, low self-esteem, all of which have come on after the stroke. As mentioned before, depression is a common side effect after a stroke, and this can affect your sexual function. Therefore, it is important to communicate with your partner your fears, your anxieties, and your feelings regarding this issue. And let them also share their expectations and fears prior to resuming this activity, which will help the experience to go much smoother. If you find this difficult to do with your partner, it is advised that you seek counseling and psychotherapy to help through the process. After a stroke, there are many modifiable risk factors that can help you prevent, or that can prevent you from having another stroke. Although nothing is 100%, and the risk of stroke does increase once you've already had one. However, it is not guaranteed that you will get another one. These are things that you can do to minimize that risk significantly. High blood pressure is the number one modifiable risk factor when it comes to stroke. So making sure your blood pressure is well managed is one of the best things you can do to avoid another stroke. Diabetes, smoking, alcohol abuse, cocaine use, uncontrolled and unchecked levels of high stress compounded with all of these can also contribute to your risk for stroke. In addition, another risk factor is hypercoagulable states, or systemic diseases that increase your risk for blood clots, such as protein C and protein S deficiency, or sickle cell anemia, among others. High cholesterol, or hyperlipidemia, is another modifiable risk factor for stroke. TIA, also known as transient ischemic attack, is a risk factor for stroke. A TIA is a stroke that resolves on its own in less than 24 hours. So basically, if you have stroke symptoms that resolve in less than 24 hours, it's considered a TIA. Greater than 24 hours is considered a stroke. However, many people express TIA symptoms at some point in time in their life and never seek medical intervention or seek the care of a doctor or tell them. A TIA is treated with medical intervention such as aspirin or anti-cholesterol medicine to help prevent your risk of having a stroke, because people who have had TIAs have an increased risk of a stroke of up to 17% within 90 days after the TIA occurs. So it's very important to seek a doctor after you've experienced symptoms of a stroke, even if they've resolved within 24 hours. High dose estrogen is also a risk factor for stroke when coupled with a history of smoking. So over-the-counter contraceptives, birth control pills, if you're a smoker and you're on birth control, that increases your hypercoagulability risk, which can increase your risk of stroke. Heart disease is another treatable and modifiable risk factor for stroke. Patent foramen ovale, which is a structural issue in the heart that can be treated, is another modifiable risk factor for stroke. Sleep apnea, migraines, carotid stenosis. So if you have any of these diseases, it's very important that you take action to get treatment and make sure they are well managed so that you decrease your risk of stroke. So, in conclusion, I want to leave you with some signs to look out for when it comes to stroke, whether it be in yourself or something you observe from another person, because the quicker you act after having stroke symptoms, the better your chance is to reverse them altogether or decrease your risk of having severe deficits or even death after a stroke. The acronym, as many of you might have heard, is called Be Fast. The B stands for balance. Look for deficits in balance. If you are with someone who normally has no gait deficits, but suddenly seems to be unsteady on their feet and has a balance issue, that is one sign of a stroke. E is eyes. Pay attention to the eyes. Do they have sudden double vision, or saying they're having vision loss and can't see out of one eye or both eyes? That's another sign. The F stands for face. Is one side of the face drooping, or is there any asymmetry in the face? That is another sign. A is for arms. Are the arms symmetric, or does one arm keep drifting? If they're doing an activity or holding something, to drop the cup, or if you ask them to hold their arms out, one is higher than the other. That's another sign. S is for speech. Do they suddenly have difficulty speaking, or stuttering, or not even getting any words out? That's another sign. Or having slurred speech, or speech that doesn't make any sense, which we call word salad, just a bunch of words coming out that aren't making any coherent sentences. The T is for time. If they have any of these signs, call 911 immediately. As I mentioned, the quicker you can get into an ER, the greater your chances are to get intervention that can possibly reverse the outcome of having residual deficits after a stroke, or increase your chances of not suffering with severe deficits or even dying. I hope this was helpful, and I invite you to subscribe to my email list to receive more educational content on topics related to physical medicine and rehabilitation. If you have anything that you would like to learn more about or have questions on, I invite you to leave it in the comments. Also, visit www.freedomwellnessphysiatry.com, where you can book an appointment to work with me if you are in the DMV area and a caregiver of a loved one who is severely debilitated in the home setting and finding it difficult to get to appointments and would like the expertise of a physical medicine and rehabilitation provider, sharing their expertise in the care of your loved one. I invite you to book an appointment and join me on this journey to living better. Have a great day.